Carolyn Webb. I'm a nurse from California, and I'm here at Dallas today, the headquarters of Astanza. Today we're going to take a look at the newest diode hair removal laser to hit the market. Let's go inside and take a look. Laser hair removal is one of the most common aesthetic procedures in medical spas today, and it has been around for over 20 years. Some of the common misconceptions of laser hair removal treatment is that it hurts, it takes too long, and that it just doesn't work. Today you will see that each of these are myths, just myths, well, at least with the Asclepion MeDioStar.
Hi, I'm Josh Walsh from Astanza Laser. I'm a biomedical engineer here for 5 years, both by training and by education. And I'm here with our wonderful nurse, Carolyn, to explain to you how to use the MeDioStar Monolith.
Super excited to learn about this today. I've been waiting for it to see how this can help me in my practice.
Awesome.
Yeah.
Let's get started.
Yeah.
Okay, so we kind of have 3 big key things when we first start up the machine. We have the start menu, and if we hit start, we're gonna go to our last settings, okay? And the machine will just go immediately there. Really, the big thing that we're looking at is our indications. So if we were going to start today, we would say, okay, we're going to do epilation, right? So we're going to do hair removal. We'd start here. We're going to figure out which part of the body we're going to be on and approximately the size of the handpiece you need, right? So we have our large handpiece and our small handpiece here. So the extra large handpiece we're going to be doing, since you're going to be doing a fine set of legs, okay. We're going to go ahead and select the area as the body. You could also select the face, but we'll start with the body here.
Can I ask a question?
Sure.
So are there any other sizes besides these 2 sizes?
Yes. There are a couple different hand pieces. We're going to be using the extra large today, which is the largest spot size. Then there's a large, which is a little bit smaller than that, and a medium, which is going to be a little bit smaller than larger than the small.
Okay.
And they range just in more as this one is of course like a large square area. The large is going to be about half that. The medium would be half of that. And then of course we have the small, which is the 1 centimeter by 1 centimeter here. It also comes with a fantastic vascular handpiece, and I'll show you how to get into those indications here in just a second.
Okay, great.
So we have our patient here. Let's say that they're a skin type 4. So we just select skin type 4. She's had a couple hair removal treatments, so maybe we don't increase the density, we just leave it at kind of sparse.
Okay.
And then we would say, based on our questioning for her, and maybe our own observations, that she has about average thickness in her hair. And then we're ready to go.
I agree.
And then the machine will automatically pre-populate what you're looking for.
Okay, great.
So let's say we have somebody a little bit more of my complexion, right? Darker hair, but more of a fair complexion. Like I can't go out in the sun very often or very long. So we go here, let's say that we're doing my beard because I'm sick of shaving the back of my neck and shaping it up. So again, we'd select epilation. We'd use our small hand piece. Area would be the face. Then I would say I'm the skin type 1, 2. I would say the density on my face is significantly more. And then of course, my thickness would be significantly more than your average treatment for maybe like a woman's legs.
Okay.
All right, and then this would be the appropriate settings that we would look for that.
Great.
Right. There is the ability to increase your speed as well as go up and down depending on the treatment settings, right? This is more of a bell curve, but these are actually really, really amazing settings, especially for your first treatment. It hits it almost every time for me.
Perfect.
Before we get started, let's look at wrapping the handpiece. They do come with a custom piece here, and it looks just like this. Okay, so we're gonna apply these kind of protective layers on there, right? So that you don't have to individually wrap it. We're gonna go ahead and put the small layer here. They do have them for different sizes on the handpiece. I usually like to go here, I take my top layer, I stretch it, and I go here, and then you just pin it down on the sides, and then flatten it out. And that keeps the handpiece from getting gunk on it, right? It's more of a sanitary measure.
How's it feel when I get to that knee?
Not bad. Not too bad.
This handpiece feels super light. Still holding up okay?
Yes.
How was that?
It was good. Yeah.
You're like, not too bad, huh?
Yeah, not bad at all.
So what prompted you to start getting laser hair removal?
I was just tired of shaving. I was tired of that.
Yeah.
And I have thick hair too, so it got annoying.
Yeah. So have you had any issues with ingrown hairs or?
Only one time I have, yes. And that kind of triggered it too.
Really?
It's like, I do not want to shave or keep shaving the rest of my life.
Have you done any other areas?
Yes, ma'am. I've done my stomach and my lower back before also.
Oh.
And underarms.
Wow. Well, there you have it. I'm going to approach this from the other area just because it's a little bit easier for me. Okay, here we go. Still doing okay?
Yes.
Perfect. Now when I come up here on the bone, I'm just going to let you know sometimes I feel that it can be a little bit bitier.
Oh yeah.
Just because it's
Just
thinner
little.
skin,
Yeah.
but still tolerable?
Yes.
Okay,
yes.
good. Josh, I'm really loving that I can move this all around.
It's nice having a square.
It is, but as far as, just sometimes when you're doing a treatment, you do have to move that handpiece, just based on your own ergonomics or trying to get around the patient. Josh, I see what you're saying about you really need a lot of gel because you're pulling it with you. I'm now understanding this. I'm so used to having to use so much gel.
Yeah, it gets, and a lot of the designs, right, it gets just caught up in the mixing corners and crannies.
It
right?
does.
You end up losing a lot of it.
Yeah, you do. You're correct. All right. Do you mind if I have you bend this leg out? Actually, it'll just make it. Is that okay?
No, that's fine over there.
It'll just make it a little bit easier to get right in here. Okay, here we go again. Ready?
Yes.
So you've had 2 treatments so far. What percentage of hair do you think you have left?
I would say maybe between 60 to 50%. But I have noticed definitely it is lighter.
Lighter, like
yeah.
a little thinner?
Yes,
Mhm.
thinner.
That's good. Okay, remember right here in your bone might be a
Yeah.
little bitey.
Okay.
How does that compare to the other type of laser hair removal you've had?
Oh no, this is way easier. Oh my goodness, it's such a difference.
How does it feel?
It feels like almost nothing. Except for, like you said, the little ankle area bone. Yeah.
Sometimes, and of course when you get an area where you still might have more hair, but
Oh, okay.
here we go. Just like to keep my workspace clean, that's all. All right, other leg. And then we're moving on to your underarms, right?
Yes.
Exciting, exciting. So on a scale of 1 to 10, how do you feel that this treatment feels?
Oh my god.
10 being the worst you've ever experienced.
Oh, okay. Well, if 10 is the worst, then it's like a 1, pretty much.
Oh wow! And then how? I'm not. What laser? Do you know what laser that you had your laser hair removal with before?
I don't know. No, I'm not too sure.
And how did that one feel?
Oh, it was much slower. Yeah, it took a while. Yes, and it's.
How about your pain level?
Pain level doesn't. Yeah, this one is much better.
Oh great!
Yes.
All important things.
Oh yes. I feel no discomfort at all. Hardly any. Hardly
Yeah,
any
sometimes
little.
around those more bony prominences,
Yeah.
you know, definitely. But you're usually over them so quick that it's very quick. You're not gonna, you know, we're not lingering there a long time. Yeah, I think if everybody could see how easy and quick and effective this is, everybody would be lining up for laser hair removal.
That's right.
Especially those men out there. I think, you know, they want laser hair removal. They're just a little weary. That's all, right?
Right.
They don't believe us when we say it's really not that bad.
No, I know.
I'm gonna have you just angle a little bit that way if you don't mind.
Okay.
Thank you. And believe it or not, we are on our last pass.
Wow.
Because obviously this is going so quick. How am I doing, Josh, on that spacing?
Doing perfect.
Oh, that's what I like to hear.
Really good.
Already a pro.
And I'm sorry, I'm leaning over you here. How was it in the center? What was it?
Not bad.
Oh, good.
Oh my goodness.
That was always what I dreaded when I would have to get mine done. Look, you're already done.
I know. That was quick.
The cooling on this box is
Oh, yeah.
really amazing.
It's-
Just that
It
quick
felt
cool
good.
down.
Yeah.
Really
Really
amazing.
good.
As a nurse with 17 years of experience with various hair removal lasers. I've been frustrated with the ease of use of other lasers and the discomfort to my patients. It's nice to see a laser like Asclepion MeDioStar address these issues and make a laser that a practitioner actually wants to use. And patients will love it as well. It's fast, it's pain-free, and it does a great job.
My treatment was excellent. I had a smooth process today and it was great. I have had laser hair removal before and it was not even compared to this one. This one is so smooth. The length of the treatment today was, it was over so quick. I didn't even know we were done and it was just amazing. My pain level was next to nothing. I felt a little prick around my ankle and that was it. It was pretty good, pretty smooth. I would definitely get the treatment with the MeDioStar laser again because I was just really impressed with the amount of time that they spent with me. It was over like really quick. I mean, I was amazed.